Hello and welcome back to Before the Medicine podcast. I am your host, Akeira Johnson. I am happy to be here. I am happy that you have joined in with me yet another week, another episode. And this week, we are going to be talking about the important aspect of healing that is related to how you remain connected and self-aware of your body on a daily basis. So I really want to talk about not just when symptoms appear, not only when something hurts, but a sacred time that you give yourself of checking in with how you're feeling at your baseline mainly, but just existing, breathing, just being present in your body without waiting for something to be present that needs your attention. By the end of today's episode, you'll understand why these practices of daily check-ins can help to prevent disease states, how you can interpret what your body is trying to communicate when something does show up, and the framework that you can use to guide yourself toward appropriate evaluation and treatment that doesn't always include prescriptions and procedures. I'd like you to stay with me just because here in the whole episode, you'll be able to understand the difference between reacting to disease states and preventing them. So let's get into it. When, if you have to be honest with yourself, is the last time that you just connected in a practice where you sat with yourself, you listened to your body, listening in silence, not necessarily when there was an acute or urgent situation going on, but you are actually tracking what your baseline is, simply knowing what that is for you, to feel how you exist when there is nothing wrong. So if you're living in this disconnected state until there are actually symptoms, then that may force a different conversation, of course. Pain that requires attention, exhaustion, that requires attention, illness, acute or even chronic, of course, that should get your attention. But what if there are some healing practices that could begin before all of that noise happened? What if there was a sacred time that you decided where you could understand your baseline, where you could notice those subtle shifts before they actually became symptoms that needed medical attention or intervention? And this is what we're going to talk more about, and getting you to feel comfortable with a practice that's such as this that you can include into your daily routine. So this sacred time, why does something like this help to heal or help to transform your healing? So, of course, there's a ton of information that focuses on symptoms. You can Google pretty much anything. I tell my patients all the time, if you want worst case scenarios, just put it in Google. And then when you want to talk to someone about what really is going on, then you can come and talk to me, a healthcare provider, and know what other options or what other alternatives may be. If you want to just wait and focus on what does this symptom mean, there's an overwhelming amount of information for those answers. That is a sick care, in my opinion, practice. But healing through being present, being aware, being connected to your body starts much earlier, in the time that you simply get to know what your body is at its baseline. And I'm not sure if we teach that enough in medicine and primary care, specifically in my case. So I've been on a mission to do more of that with just my work in coaching and education, in addition to traditional medicine. So what is this sacred check-in? And in plain terms, it's not necessarily a medical assessment. It's not tracking symptoms. Again, we're doing this before the symptoms arise. It's dedicating time, hopefully daily, to connect with your body without an agenda. Just being present. It's quite boring, actually. And in this case, boring is good. So it's time where maybe you close your eyes and sit with yourself. You breathe, controlled, quietly, without any kind of stressful or urgent need to hurry up and finish, but at a time where you can really sit, You can scan yourself from head to toe. You can assess your energy levels. You can feel where you're holding tension, your emotional state. How do you even feel about engaging in a practice such as this? How does your digestion feel? How has it felt up until the time that you last sat with yourself? What is your sleep quality like? So, do you wake up feeling like you're not well rested no matter how much sleep you're getting? Or is your sleep dependent on some other external factors that you have yet to assess or to shift in your lifestyle? How does your body just feel existing in that moment with your day to day, the amount of tasks that you demand of it, command of your body? How does it feel with being able to support you? Why does this kind of practice matter for your healing, especially being taught by a doctor who practices general traditional medicine in addition to medicine that doesn't require you to take prescriptions and participate in procedures, that blending of the two? But why does something like this matter? It matters because you need to know what your normal is like. I was always quite surprised when I was in the clinic and talking to patients who had no idea what this part of their body looked like. For example, if I was doing screening, and we talked about how do they screen that aspect of their body. I think about women and breast cancer screening. Well, even before you get into a machine, what do they look like? What does the skin look like? Is the shape? Is there asymmetry? I would ask these questions and encourage them to understand their baseline. And some of them had never heard that before as a part of the practice and waiting for a lump or bump or mass. Well, we want to get to any kind of physical changes or be aware of them well before that shows up. So that's just an example, but that would be an example of something in preventative care or screening that would be an easy way to say, hey, are there parts of my body that I don't really pay attention to or don't know that well? So when subtle shifts happen, energy, let's say change in energy, tension increases, whether it's physical or you're feeling that emotionally. If there's a change in your digestive pattern, you notice that possibly before it becomes a disease state, but you notice it so that you can then decide, hey, is there something else in my life that's changed along with this? Or is it time for you to seek medical attention? So this all can be a part of the foundation of healing, but healing through remaining and approaching your body from a connected state. And so if you've not been taught that, well, you're in the right place. We can start here. We can start today. So what are some of the benefits of daily check-ins? Well, it does strengthen the interoceptive awareness that you have. Again, this relationship that you're able to internally or inwardly be able to assess and not wait for things to present just in an external fashion or a symptomatic fashion. And sensing these signals, you become more of an expert of when your baseline is imbalanced, when your baseline is put off by something. So strengthening this connection can detect any imbalance that you may need to address, or you may need to have a conversation with your healthcare professional. So when symptoms appear, what exactly is your body trying to tell you? Well, of course, it depends on the symptom, but when you're connected to your body, you have the opportunity to hopefully address the symptom as communication and not a crisis because it's been ignored for such a long time, or because you've been so off or so disconnected from what your baseline is like that you didn't even pay attention or weren't aware that subtle signs were showing. How does one start to interpret body communication when symptoms appear? Well, when symptoms show up, I would suggest you pause if you're able to. So of course, I'm not talking about an urgent or a medical emergency. I'm talking about maybe there's a shift in your digestive pattern and it's slow changes that you see and you notice this, but you notice it right away because this is not your baseline. Doesn't mean you have to immediately have something done that is procedural or invasive. Probably not. But does it mean that you have the opportunity to look at your lifestyle practices and see if there's something there that is worth you addressing or changing or shifting so that it fits your needs and where you've had a shift in this balance. I would ask this question, and I would actually suggest you either you're thinking of this as something you're going to speak to yourself, you write it down, however you need to do it, but you're literally asking your body, hey, what are you trying to tell me? Persistent headaches could be several things. This is not medical advice for your specific situation, but if you have to seek care, is there the opportunity for you to say, hey, am I hydrated? Have I been sleep deprived? Do I have some chronic stress or a change in my stress level that I've not been able to manage well? And so because of that, this symptom is coming up, i.e. a headache in this case. Could digestive changes mean that you have a change in food sensitivities or tolerances? Is there a stress deregulation? Stress is a common theme here. Is there the chance for you to look at how your gut bacteria, microbiome is a fancier word for that, to address how your body is in that current state? Is there an imbalance there that could be corrected, and not just discomfort that could be ignored or masked with some band-aid of a treatment that really doesn't get to the core issue? Could fatigue be your body requesting more rest and deep rest? We had an episode about that, and where rest needs to be looked at as part of your medicine and part of your lifestyle for health and wealth. Could there be time for you to adjust your nourishment, your nutrient? Are you eating more nutrient poor foods, processed, versus the density of the nutrients that are actually supporting your wellness and your health journey, and what your body needs as those building blocks as fuel? Again, stress, could that be affecting your energy levels and creating fatigue? So not something that you just want to slam down coffee, slam down an energy drink and just continue to power through, but the ability to stop and pause and say, hey, my body is trying to alert me of something that needs to change here. So this kind of practice of listening to these symptoms before they are ignored for too long or masked with a treatment that really doesn't serve the underlying goal, it really guides you toward the appropriate, not just evaluation on your own, but even with a healthcare provider, and treatment if and when that's necessary. Sometimes this does include medical intervention. So again, this is not an episode to give you medical advice stating that you ignore, you don't go to the doctor, you don't seek treatment. Absolutely not. That's silly. But if your body is asking for lifestyle shifts before something like that were needed, it might be time to audit those areas in your life, your rest cycles, your nourishment, your stress levels, your movement practices, just your connection to your external environment. Is there room for those behaviors to change? So let's talk about briefly the framework of this body guided and awareness treatment. Think about this in steps. So talk about step 1. Connecting to your body daily. So this needs to be a non-negotiable. This is something that you do at some point in the day. You decide morning, midday, afternoon, 5-10 minutes. I would just figure out a micro time that you can commit to, that's yours, that doesn't jump all over the place, it's not interrupted, because connecting with your body, let's just say first thing in the morning when there's not a lot of stressors, the world hasn't had its way with you, and you may feel much different then than you feel at the end of a day, especially if it's at the end of a work day or the end of a stressful work day, being in traffic, just life things that happen. If you have several times a day where your check-in process, you assess how you're feeling in the morning, you assess how you're feeling at night, and purposely you see the difference between those two times of the day so that you can make better choices, then that's great too. But I would define times that you're able to set up and keep that practice. No phone, no agenda, not multitasking, just you and you. I love that. I talk about you and you a lot in my episodes, but this is between you and you and your body. And when you're assessing these things, really assess them, and you don't have to skip over any part. You don't have to judge any part of it. This is going to be your foundation, and going forward, you get to learn what this is like. So when something is off, you know where your baseline should and usually is. You can ask yourself in step 2, when symptoms do appear, what is my body trying to communicate with me? whether you write this down, whether you are, talking out loud to yourself, and that's okay. It's between you and you. What preceded these symptoms? Is there something that has changed in your routine, your environment? Are there other patterns that are associated with this? For example, does stress trigger a migraine? Do certain foods trigger inflammatory symptoms like pain or change in digestion? Does lack of rest or a disruption in your rest cycle lead to you not feeling so well or catching illnesses like the common cold or other symptoms that you typically don't have? And in step 3, are there lifestyle patterns that are safe enough to consider? And I'm going to intermittently say that because, again, this is not to take the place of modern or traditional medicine that's needed. I'm going to always be an advocate of that. I practice that. That's part of my job, but in a way where we can use both lifestyle and medicine when needed is my MO. But if it's signaling that, for example, in this case, if you have a lifestyle practice that your body is signaling that you need a change in your diet or your nourishment, then do that. It's, of course, if it's within your ability to do so. Do you have to throw everything out in the fridge? No, I like micro steps of. So when I say do that, I have people that come to me and I'm like, they really have not made this connection. Even when I was teaching resident doctors, they would present with patients that say, hey, I'm having difficulty eating dairy. I'd like to be tested for lactose intolerance. Well, that's the test. Like you already came with the results of the test. The test is that your body doesn't like dairy. Your body has maybe tolerated it up until a certain point. It's not actually natural for, as a mammal, us to have the milk of another mammal. No other mammal group does that, but it's cultural. There are, societal things that go with that. And so if people choose to have dairy, but then at some point, if their body's not in agreement with it, there really is no test greater than the test of your body saying, yeah, every time you have this, I'm going to give you a symptom that's going to show you I don't really enjoy this. So in this example, specifically in talking with the resident, I said, hey, this is the test. And even if we had a test that told us the same exact thing that they're experiencing, I want you to think about right now what advice you're going to give them as a treatment or as a solution. It's going to be, let's remove that thing that your body is not doing well with. It's not something that you have to have in that form. We can still get you the vitamins, the nutrients that are fortified in that food group, but we can do it in a different way. That to me is a better solution than continuing to expose yourself to the thing that you don't feel great ingesting in this case, and giving you a medication to mask that so that you can just enjoy having, let's say, ice cream. That's silly. It doesn't make sense. And again, I can laugh about it because it's like, well, that kind of is a waste of money and time and your discomfort when you can remove the thing that your body is not reacting well to and give it the thing that it really will fuel from and optimize its functioning. And a very specific example, but if you are trying a lifestyle intervention and if you're able to safely, try it for 2 to 4 weeks. This still may be under the surveillance and the practice of a healthcare professional. It's not that you have to do this on your own, but I would suggest you give it an optimal amount of time to actually see the difference. The last one, I kind of mentioned it already. Still, with everything that we talk about and doing before the medicine and advocating for lifestyle change, do not fear partnering with your healthcare provider. Don't delay that. Don't think that you are or you have to go at this alone. There are a lot of providers, even in a very traditional healthcare system, at least in the Western world, that will have this implemented into their practice style, are willing to meet you where you are if you're not 100% interested in traditional treatment and medicine. But of course, seeking medical attention or evaluation if things are not getting better, but letting them know that what you've tried up until then, what symptoms you've tracked, what you know is your baseline, even doing that part is important information for you to present in a traditional healthcare system, again, in the Western world, as a partner and not just a passive participant or patient saying, hey, this and this happened. I don't know what's wrong. Treat me. Well, what would have been your signals and the communication that you've picked up on up until then? That's going to be vital information. But what have you tried? What have you noticed after you tried? This is the kind of connection that even when you need traditional treatment, you're able to provide valuable information that will probably get you further in earlier visits. So it's not this long drawn out process and mystery of starting from scratch because we don't know what your baseline is, or you've not been seen, let's say, by a provider in a while, not paid attention to how your body's been changing and shifting, and things are just prolonged unnecessarily. If nothing else, you're looking at this as a guide for potential solutions if your body does need more, but definitely not a way that you're going to show up after symptoms have been suppressed for too long. I want you to see what changes in you when you're able to be guided in this way. When you commit to a daily practice that will allow you to be connected, aware to your body, you'll notice that symptoms become more of a guide. And again, not an emergency, because you understand that this is a shift from your baseline. Treatment can become personalized. That's great. Who wouldn't want that in their healthcare, in their management system as a part of their healthcare, and not this one size fits all, but really based on what you're presenting with. Medication and treatment becomes more strategic and not just the default because it's been too far out from when symptoms have started, or there are no other options because we don't know what a baseline is like for you. And you become a healing partner. Big on partnerships with my patients. Talked about this in another episode where, there's mutual decision making, but you're really presenting and making decisions with your healthcare provider, hopefully as a united front, and not feeling like you're just being told what to do or misunderstanding and unaligned with what is next in your treatment because you're not aware of what your baseline and what your options truly are based on the needs of your body. So it's not about rejecting medical care, not a healthcare provider who doesn't believe in what she actually does. I also believe in honoring the wisdom our body innately has and how important that is to the whole process of healing. So with that, I talked about how much I love giving out homework in the last episode. And as long as this works and we get some engagement, I'm going to continue to suggest things that maybe we can do as a community and by the week, that again, these micro bites that hopefully don't feel too overwhelming, but you can decide where and when it fits into your own life and lifestyle. My assignment for this week, that 5 to 10 minute micro time that I suggested earlier, carve out a time for that, something that you can do daily or as many times this week that you can. Hopefully the same place, hopefully the same setting as well. I didn't mention that, but if you have a favorite chair, if you do this as a part of your, let's say, your hygiene routine, where before you get in the shower, or after you get in the shower, for example, you just sit with yourself and that's your Zen moment, great. But if you're able to sit quietly, if it's safe enough for you to close your eyes, take deep, intentional breaths, scan your body in a way that feels, and there's no judgment. You're not trying to fix anything. You're just listening. You're connecting to this machine, essentially. I mean, our bodies are not machines in the mechanic state, but it's this complex system, essentially, that keeps us afloat every single day that we're alive and breathing. But there's so many pieces of it. And I don't think that we look at it in that way as much as we should, as much as we can. A lot of us are just on autopilot, myself included many times. But when you're able to shift into this practice where you give your body the time that it needs to just let you know if there's anything going on. And if there's not, you're just present with how you get to show up at your healthiest state. That's great. Either one of those, but a practice that you can actually jot down if you feel like doing so, pay attention to, but at the end of the week or throughout the week, even how does that practice make you feel? How does a practice like that change your perspective on your health or your wellness journey? And noticing any shifts in that, then is it time for you to maybe get that in between checkup or that checkup that you have been putting off for some time. And this is between you and you. There's no right answer. There's no wrong answer. I think that reflection is just meant for you to see if this is a practice that you are able to keep up, if this is really something that you found beneficial, and how this can now be your new autopilot. So if ignoring and not paying attention was previously on autopilot, just powering through your days, your weeks, and then you look up one day and there's something that you should have paid attention to a long time ago, well, can this now be the new autopilot, but in a way that serves you better? So with that, what would you change, or what would you see would change in your wellness practice if you were able to do something like this daily, beyond the week of the challenge that you're able to do this week? But what would you actually see as a change in your wellness journey? Comment below. I will read all the comments. I will reply if it requires one. And if this inspired you to create this time for yourself, just think of somebody that may also benefit from that, or from this practice, this message, and share it with them if you feel called to. With that, I will end this week's episode and plan to see you next week. So go, as I usually say, get out of here, live your life, take action, and hopefully you take action in your lifestyle so that you are able to connect with the highest version that you see yourself being, or that you align yourself with being, and your wellness journey. Take care. I'll see you next week.